My name is Rajesh Menon. I am a consultant in anesthetics and chronic pain, and I work in Calderdale Huddersfield NHS Trust for last 11 years, and I'm also working in Spire Island Hospital. Oh, that's an old story. It was introduced by my grandmother. She wanted to see her grandson. She was always telling stories, and one of the stories was about doctors. And she was wanted a grandson to be a doctor, and that somehow kept in my small mind when I was a small boy. Went on carrying on, and I like the book called Citadel by A.J. Cronin, a very good book, and that book may inspired me to be a doctor. Again, is influenced by one of my senior doctors, my teacher. He was in India, Dr. Rajagopal. He was a palliative care consultant, and he was an anesthetist by profession like me. And then he thought he'll help the cancer patients and seeing them crying and pain. And he developed a holistic approach of treating pain. And he did very well. I was inspired by him. But as years went by, I found more fruitfulness of doing pain as I get the reward. Patients being happy with pain, coming out of it, relieved with pain, at least understanding how they are. Because if they are the people who have not been understood much, and the most common cause of patients visiting hospital, and once they get better and they put a smile on their face, makes me feel better. Just as I told a line before, when the patients smile and say thank you, that's the biggest reward for pain. And in pain clinic you can get that more and more. And it's a teamwork. We all work as a team. The staff, nurses, everyone are excellent, and that makes you feel as a family. We should ask the patients. The feedback forms is what they say. I think one thing they've probably commonly told is that I listen to them. I take time in explaining what's the problem with the patient, so the patients feel that's not in their head and they understand it. I may not be able to relieve all their pain, but at least I'll be honest what I can and what I can't, and that's what they accept. I always talk about back pain. Majority of patients who I see is back pain. That's the most common to come to pain clinic. And one of the things I always show them is the MRI scans the muscles in the back, and they are like the scaffolding to your back. So you can't build a scaffolder on your back and walk around. At least you can make the muscle strong. So that's a mantra I use. I also make the muscle strong, keep the muscle strong, build your muscle. And that exercises and rest and all are just helping you to get back to feet.